We have a guest joining us in the studio this morning from Tripp Family Medicine here in Twin Falls. Jeremy Daly is a physician assistant at Tripp Family Medicine and is part of the usual rotation. Of course, Jeremy spent a lot of time with us when the doctor was away in Central America this past summer. Jeremy was the main pinch hitter for that stretch. I think that entire month, just about.
Something like that. Seemed like it was a long time.
Welcome back.
Thanks. It's good to be here.
We were just talking a little bit about abdominal issues. Some of those, of course, are from muscular or they're from the outside of the body, and some of those sometimes are from your internal organs and the like. I'm sure that any number of things people have. I mean, just a simple pulled muscle, I would assume, is fairly easy to diagnose, but sometimes when you see people and they're complaining of something, it's often a symptom of something I'm sure that's worse.
Yeah, it can be. And you try to look at the global picture when you're making any kind of diagnosis on people, and people come in. I When I worked in the ER, that was probably the most frequently seen diagnosis was some sort of abdominal pain. And the reason is people know that their vital organs are there, and even if it's something like you said, musculoskeletal, something on the surface, sometimes it's difficult to differentiate between something that's on the outside and something that's on the inside, especially if it's a deeper muscular pain. It can be difficult to differentiate between those. And so, really what I want to talk about today is, well, when do you go in to be seen? Because a lot of times these things can be managed at home or on your own, but there's plenty of times when you need to come in and be seen and be evaluated, and sometimes the treatment is emergent or urgent, and so it's important to know what kind of pushes you over that tipping point to come in to see the doctor.
For a lot of people, I mean, if you see a 17-year-old that comes in and they've been playing basketball or lacrosse or football, oftentimes you could probably think, well, maybe they stretch too far, and that's where it becomes that muscular issue. They may have pulled a muscle in the abdomen, and that can be painful, obviously, and it takes a little time for that to heal. But you just simply have to, offer them the idea that you don't go out and overdo it for a few days, right?
Sure, sure. And that's a great example, Bill, because sometimes people come in with what seems to be a straightforward diagnosis. Someone playing football or lacrosse or, some sort of sport, and they come into the clinic complaining of pain in the belly, and you think, oh yeah, well, what have you been doing lately? Well, I've been playing lacrosse or I've been doing some sort of vigorous exercise. And so you could jump right to the obvious diagnosis and miss something really pretty important and maybe even life threatening if you jump right into that. So that's the importance of doing a really good history on the patient. So that's one thing that I think we really pride ourselves on is spending that extra time with the patient to take a good history, do a really good physical on the patient. Find exactly where the abdominal pain is, or if it is muscular, we can differentiate pretty easily with exam. And there's been plenty of times where people come in with a seemingly straightforward diagnosis or what seems to be straightforward, and you do a really good history and physical. Come to find out, it's something that's a little bit more insidious, and it's something that needs to be addressed in an emergent manner.
Years ago, and I throw this out there as just being one of those unusual ones, woman I worked with, her sister had to go to the emergency room, went to the emergency room complaining of some, abdominal pain, and they discovered that she was having a baby. She hadn't even known that she was expecting. I would assume that's rare, but I'm sure it has happened to other people in the past too, as well.
Oh, certainly. One of the things that we see probably more commonly than an unknown pregnancy is something called an ectopic pregnancy, and that's a life-threatening situation. I've been in a couple of situations with patients where they were basically they had a ruptured ectopic pregnancy and they had some internal bleeding and their blood pressure was dropping and they had to be taken to surgery emergently because of that. So yeah, it's one of those things that you have to kind of key into what the histories of the patient. The gender of the patient is a huge
Hmm.
deal. Obviously, men come in and you don't worry about pregnancy ever. Luckily,
Yes.
that's one of the good things about having guys come in. Women come in and sometimes it's a little bit more complicated. They have, different parts than men do, and so you have to take that into consideration because a lot of times that can be the underlying cause.
We have more coming up, but Jeremy, for people who'd actually like to get in touch with the doctor's office, they can do that a number of ways, right?
Definitely, we'd love for you to come into the clinic. It's 1411 Fillmore Street, across from the post office. You can call us at 933-4400, and you can see us on Facebook. And we're about to launch a new webpage pretty soon here too, so there's going to be some more content there that I think people will like.
Some videos too from some of our shows.
Yes, and you know, as much as as much as we like people to listen on the radio, if they can tune in to the website and see some of those videos, that'd be great too.
I know there was some talk at one time. Charlene was thinking you could put them up on the TV monitors in the waiting room, and people could literally sit there and get an education as they waited to drop in and see one of you.
Yeah, I think that's a great idea. I'm if they want to spend that much time with us, then that's great. They may not want to.
Yeah, I know. I went to Lake Placid one time, and I went into the old arena where they played the big hockey game against Russia,
Yeah.
the Soviet Union in 1980. And do you realize that they have a screen there, and it plays on a continuous loop, 24 hours a day, 7 days a week?
Oh wow.
People can just come by and relive that experience. Although here we are, almost 40 years later, and they're like, "Who is that?" We've got more with Jeremy Daly coming up from Tripp Family Medicine. 20 minutes away from 9 o'clock. It's 38 on Top Story with Bill Colley as well. Our guest in the studio is Jeremy Daly. He's a physician assistant at Tripp Family Medicine right here in Twin Falls, Idaho. We call this Better Health with Tripp Family Medicine. They have a great slogan, Life's Too Short Not to Feel Good. And I was just telling Jeremy how good I feel because my abdominal area is getting smaller. It's 8:45. We're about 15 minutes away from 9 o'clock. It's 37. Any number of things can be the cause here, obviously. We were just talking off air about sometimes it's a GI issue, but really, if you have some people have a GI issue for a day and it goes away, but if it persists, the pain persists, then it could be something far worse.
It definitely could. We really divide things into quadrants and areas when we're evaluating the abdomen, and we do that for a number of reasons. One is really that when we divide it into a quadrant, it's easy to determine, well, what part of the anatomy is actually affected by
Hmm.
by the pain, or what's going on in that particular area anatomically. And so we kind of think about it like that. So we have what's called a differential diagnosis and say, okay, so let's say someone has a right upper quadrant pain, kind of if you divide the belly into four parts. And we think about the anatomy up there. We think, there's the bile duct up there. We think there's, part of the colon up there. There's part of, the liver's up there. And, sometimes you can feel pain up there when it's kidney related. And the other thing that people miss a lot of times is the fact that the lower part of the lung is felt there too. So there's a lot of times when people come in with abdominal pain, and it can be something like a pneumonia, can something be something like a pulmonary embolus or a blood clot in the lung. And so, we try to keep this broad differential diagnosis, and we kind of whittle it down based on, well, are you having difficulty breathing? Are you having any GI symptoms? Things like diarrhea, nausea, vomiting. Are you having a fever? Are you having chills? Are you having body aches? So we use, all these symptoms together and say, hey, it probably is something like the gallbladder, which is a common
Hmm.
abdominal problem, especially in adults and adult women. Kind of the demographic that we're looking for are people that weigh more than they should. They have, especially in women, um, they're over 40 and they've had multiple kids. That's the demographic that we're looking for with the gallbladder disease. So those things have to be taken into account when we're trying to make a diagnosis as well. You don't see that very often in children. Nowadays, actually, you're seeing it more and more just because of the diet that kids maintain. Those high fat diets over time start to produce gallstones and problems like that. So eventually they can develop gallbladder disease even as a teenager.
I know two people who've had their gallbladders removed, and they said it was a fairly routine, they believed routine procedure. And I know there's not really any routine procedure, but once it's gone, are there any health concerns afterward?
It really the gallbladder, some people believe it's somewhat vestigial. It doesn't have a lot of important function in the body. But it is a storage depot for bile, which basically helps to emulsify fat for absorption. So it breaks it down so that your body can take it up and use it. So probably the most common complaint that people have if they don't have a gallbladder is when they eat fatty foods. It just doesn't. sit well with them, kind of irritates the stomach.
So they might get more abdominal issues.
Yeah, just some discomfort more, maybe some bloating and gas and can change their bowel movements. But
The other one I remember being common when I was a kid was kids getting their appendixes removed, and that would usually end up with somebody having some abdominal pain, and then and in that the percentage of kids back when I was in school in the late '60s, early '70s who had that done must have been, I don't know, 10, 20%, if not more. I mean, it seemed to be so routine that people were going in and out of hospitals constantly, uh, right up there with tonsils. I don't know if we still have issues with a lot of appendicitis cases, but um, do we still see a lot of that? And can you pick that up through a diagnosis quickly?
yeah, definitely, we see it a lot. In fact, we had what we call an acute appendicitis in the office just a week or two ago, and we see it all the time in the emergency room. We see it just about everywhere, and we even see it in adults occasionally. I had a friend recently who had a bad case of appendicitis, and he's in his mid 30s, so it happens at all ages. But the typical uh, demographic that we see is, yeah, children tend to develop these appendicitises, and yeah, it's fairly easy to diagnose because kids are not like adults in a lot of ways. Um, one being that when they're sick. Adults sometimes milk it. That's one thing that you learn a little bit when you're in medicine, that sometimes as adults we when we're feeling discomfort or pain, we we tend to overplay the symptoms and, be a little bit more dramatic. But kids, they don't want to be sick. They don't want to be lying in bed. So when kids come in and they're really sick, you take it seriously.
When you're dealing with these situations with people, is there a way? I mean, I don't know how if medicine's changed. Is it still routine to take the appendix out, or are there ways to treat it and maybe leave it behind?
That's a good question. Actually, some research actually suggests, and it's not the standard of care in America, but in places like Europe, they're starting to do medical management of appendicitis. So that means they're giving IV antibiotics or oral antibiotics, and they're seeing that a lot of times these appendicitises will resolve on their, well, not on their own, but without surgery. And so we tend to go right to surgery here. Um, that's the standard of care in America, so that's what we do. But I think there's some up and coming research that suggests that maybe we don't need to do that. That there's better ways of taking care of that.
In one area too, I guess you deal with people with ulcers. They're going to have obvious abdominal issues. Um, uh, that one we used to the jokes about the guy who's under stress at work, of course, is the most common one about developing an ulcer. But I'm sure that all of these things can cause abdominal pain too. But my guess is there are different types because sometimes that abdominal pain you might feel in your lower back too as well. Other times it might be in your upper abdomen.
Hmm.
There's any different number of places that I think could hint as to what it might be.
Yeah, exactly. So we talked about the right upper quadrant. Another kind of pain is the epigastric pain, just right below the ribs there, right below the sternum. Um, a lot of things are there. We talk about um, sometimes it's biliary. So things like gallstones can be felt there. Sometimes it's the pancreas, the stomach, like you mentioned, um, and there's other things that are there too, like the heart. Sometimes can be felt there, and so you try to keep, like I said, a broad differential diagnosis. But you're right. A lot of it, you know, a lot of these abdominal pains, we try to say, well, this acute or is this chronic? The acute abdominal pains, we try to image and do tests on a little bit more quickly because we don't want to miss something. And sometimes we overwork those up. It's a simple infection, whether it's the stomach flu or something like that that happens. We, depending on the location, we may be a little bit more overzealous to take care of that because it's an acute condition, whereas something like an ulcer is kind of a chronic nagging condition. And I've had a lot of experience with that recently, where patients have had this chronic nagging epigastric abdominal pain, and you get their history from them, and you find out, well, they take daily Advil or Aleve, for their aches and pains, but they're taking kind of a higher dose than they should on a regular basis. And so you put it all together and you find out that, oh, this is probably an ulcer. And so you look into it a little bit more, and I've had patients that have been severely anemic because of it, some that required almost immediate hospitalization because their blood counts were so low and they were so symptomatic because of a bleeding ulcer in the stomach.
Want to point out, coming up on 8:53, Jeremy Daly is our guest in studio from Tripp Family Medicine, and we're talking abdominal pain today. Right now, it's 38. Bill Colley with you as well. And if you'd like to reach Jeremy while he's in the studio, the telephone number is 736-0300. That's 736-0300. Or you can send me an email at bill.colley@townsquaremedia.com. My email just timed out, but I'll get back in there and check it for messages in a moment. Jeremy, with about 5 minutes to go, I know you have a lengthy list of things you wanted to mention as well, and maybe to hit on some of those before we wrap up too as well today.
Definitely. So, a couple of the things that I wanted to mention. One is urinary abdominal pain. So we talk about things like um, stones, kidney stones. We talk about things like kidney infections, like a bacterial infection of the kidney, and those are sometimes difficult to diagnose as well. I mean, a lot of times we feel them in the flank, the back, but occasionally we feel them in the abdomen as well. Or if it's a urinary tract infection, you may feel it down in the bladder, just right below the belly button. So you take, like I said, you take all these symptoms, you put them together, and you say, okay, what could this possibly be? Um, Now, as far as things that I'd want people to be conscientious of and say, yeah, it's probably time to come into the clinic. If you're having abdominal pain worse than you've had it before, most people have had some abdominal pain or discomfort in the past, and so if it's unusually painful, then that's a good time to come in. If you're having fevers or chills or body aches, that's a good time to come in, especially if it's with that really um, painful abdomen. Um, if you're seeing changes in your bowel movements that look like blood or even like dark tarry stools, then we're thinking about things like, well, is this from bleeding in the colon? And if you see blood in the urine, that's another good time to come in. So looking for those concerning signs and symptoms really lead most people to say, okay, I need to come into the clinic. This is kind of beyond what I can manage with a little bit of Pepto-Bismol or Imodium or something that you can get over the counter. It's something that needs to be evaluated a little bit more thoroughly.
We have a caller with us. Caller, you're on the air with Jeremy Daly from Tripp Family Medicine. Go ahead.
Yes, thank you. I have experienced severe pain. A week ago, last Sunday, I didn't know if I should check myself into the emergency room or the mortuary. uh, it was just above the left, or the bony structure on the left side, kind of around the left back and then around to the front. And it was severe. It hurt so bad. In fact, I did get up. It was about 2:30 in the morning. I drove over to the emergency room, got out, walked around a little bit, and it started to ease up. But I didn't have a good night that night. What on the left side could cause that much pain?
Well, there's quite a few things on the left side. Sometimes it can be heart-related pain, like I mentioned earlier. So you want to be really conscientious of things like that. If you haven't had a recent evaluation of your heart, that's a great thing to check into. I mean, it can definitely be things like in the colon. I've seen patients have severe pain just uh, from gas. Just increased stretch of the colon. Um, the pancreas is another thing that sometimes people feel on the left upper quadrant there, and the other thing I mentioned earlier was the kidneys. There's a lot of times when you feel that sharp pain because of something like a stone in the kidneys. And probably the other thing, we always try to rule out bad stuff first. We don't want to say, well, it's gas or it's indigestion. So we like to rule out, is it this the heart? Is this something to do with the vascular system? Sometimes you can get what's called an infarction of the bowels, where you have a blood clot that goes to the one of the bowels, and basically the bowels will lose blood supply and become necrotic and die. So it's one of those things that if it's that severe, it's good to be evaluated.
Want to thank him for the call. We're coming up to the end of the half hour, but do want to remind people we do this all over again with the folks from Tripp Family Medicine every Wednesday between 8:30 and 9 o'clock. And Jeremy, that contact information at the office again.
933-4400, and come see us in front of the post office at 1411 Fillmore. We'll be happy to take you, even if you're a new patient, and we love seeing all ages, from kids all the way to really, really big kids.
Yeah, some of us is bigger than others. I want to thank Jeremy for dropping by. Hey, coming up in the next hour, got a lot to talk about. All of us talk about rigged elections. I want to share a couple of thoughts with you about the history of that actually in the United States. It's got a history that goes back almost as old as the Republic. That's on the way right here on Top Story.